Hi, everybody. It's great to be here today with Hopkins at Home. My name is Dawn Teal. I am the SNF Agora Institute Associate Professor of Political Science in the School of Arts and Sciences here at Johns Hopkins campus in Baltimore, Maryland. My research is on women in politics, and a lot of my research looks into gender in the profession and political science. So I'm delighted to be here today as host and part of this panel with two esteemed colleagues, one of whom is a professor of nursing and the other who is a retired special agent for the FBI. So if you take a moment and you forget all of the pre-programming materials that you have read for today, take a guess as to which one of our guests up here, Dr. Rhonda Glover, Reese, or Jason Farley, were members of the FBI or professors in the School of Nursing. If whatever your quick thoughts were, they are probably wrong. And this is why this is such a fascinating conversation to be having with both of our guests. Dr. Rhonda Glover Reese was an agent in the Federal Bureau of Investigation from 1984 until 34 years. I haven't done the math, but relatively recently. After which she became a career and youth mentor coach, focusing on developing law enforcement leaders and assisting individuals in becoming law enforcement professionals. And she is now head of the Rhonda Glover Group LLC, which is a coaching, mentoring, and training group. And we're going to hear all about all of her experiences, both as a mentor and a coach, as well as an FBI agent today. And Professor Jason Farley, who is a world-renowned nurse scientist and the inaugural Leadership and Innovation Endowed Chair at Johns Hopkins School of Nursing, directs the Center for Infectious Disease and Nursing Innovation. So I'm sure he's just been having a bit of a vacation the past 2 years. He's an infectious disease nurse, epidemiologist, and nurse practitioner here, and has a clinical practice here as well to spread the prevention of HIV/AIDS. So thank you both so much for being with us today. I'm delighted to engage in this conversation. And I guess I wanted to open it up by asking, Dr. Glover, when did has intelligence always been primarily the domain of women? What is the history of gender in the profession of intelligence? I don't expect that you're a historian of your field, but can you give us a sense of the gendered profession, like the landscape over the last 50 years? And then after that, I'll ask the same question to Professor Farley.
Well, thank you. First of all, thank you for having me. It's just an honor to be here because, I love Hopkins. So when Hopkins calls, I'm right there. So women in policing, in law enforcement, the first police officer was sworn in 1910. And what she did was she just focused on cases related to youth. And prior to that, in late 1800s, women were on the police force, but they were, they would oversee women that were in jail or in prison. That's what they did. But what's interesting about that first officer, she was sworn, but she didn't have a gun. She didn't carry a gun, but she was a sworn police officer, which was just very, very interesting to me. But fast forward, from an FBI perspective, the first, female agent to go through the academy was in 1972. And so that was after J. Edgar Hoover had passed away. And so, because he when he came on board, one of the first females that worked as an agent, she was there for 2 years, and he asked her, just there's not enough work for you here, so resign. So he just pretty much asked her to leave. And so there were some other women that were there with her, and they eventually left as well. And so the numbers in the women in policing have steadily gone up, but not to the rate that they should. Right now, it's at about 12% women working in law enforcement. And so there are different projects that are going on right now. The 30 by 30 initiative, where the premise is to get 30% of the police force as women by 2030. And so there are several agencies and police departments that have signed on for that initiative to just really be more intentional about bringing in women into law enforcement. And so it's, the numbers are still low. Even in the FBI, the numbers are low. Women are just a little over 20%, 21%. And you're talking over 13,000 agents across the country and the world. So, the FBI has some work to do. So that gender imbalance, it's hovering, it's there. But while we know there's a lot of work to do, it's being done. It's being done.
Persistent. And Professor Farley, what about the field of nursing?
Sure. So, as you said, I'm not a nurse historian. So, as your classic academic, I phoned someone who is to actually find this information out, because frankly, I've never once in my 30-year career had a single lecture on men in nursing and the history of men in nursing. So I had no idea where to begin to answer this in history. So in speaking to my colleague, Pat O'Brien, who is a nurse historian at the University of Pennsylvania, my eyes, quite frankly, were opened greatly. Some of the earliest formal roles for men in nursing came from monasteries, monastic societies and orders. For example, when pilgrims were coming to the Christian-based Holy Land, there was the Knights Hospitallers. Interesting choice of words, given that the formal hospital didn't exist in the 11th century. So whether or not that's an origin of that term or not, I'm not certain. Moving on into the 16th century, again, monastic orders. So there's actually a Saint Camillus, who basically is credited with forming the association of the Red Cross to mean health. And he was a nurse in a monastic order. And so our American Red Cross comes from a male nursing order of the 16th century. Interestingly enough, not until Nightingale comes onto the scene, Florence Nightingale in the 1800s, did the professionalization outside of religious orders or related to war, did the professionalization of nursing come into being. And Nightingale was clear, this was a woman's profession. Men had no role, according to Nightingale, in this society and this profession, unless it was related to their labor and their ability to lift things, pick up patients, move them from point A to point B. That was their only role. Nightingale is also credited with making the nursing profession focus principally on white women. So she not only was an aristocrat, but much of her teachings and her focus on her nursing schools that she established were ones that targeted both affluent and non-affluent women, but principally for white women. The first actual male training school for nursing didn't open until 1888. And it was to train male nurses, to go into psychiatric facilities because they needed to be the brute force to be able to hold patients down, to administer therapies, which were brutal at that time themselves. And then so the first one was 1888, and then the second didn't open until 1914. Fast forwarding a little bit in time to World War II, there were many servicemen who were trained as nurses, but who were unable to be deployed because they were not deployable as a man serving as a nurse at that time. So only women were deployable. Interestingly enough, when you look at race in the profession, Black women were second after white women, and then white men, and then Black men. So they actually had an ordering of how people were admitted and allowed to practice nursing historically, with African American men receiving that ability at the latest point in time. Finally, I would say, fast forwarding to kind of a more modern approach, for me, myself, in undergraduate, there were 4 men in a class of 50 students at the University of Alabama. Flipping that coin, when I did a master's in public health and epidemiology, I would say it was 60% male, right, at that point. Going back and becoming a nurse practitioner before I went on to do a PhD, again at Hopkins, that 12% number that Dr. Reese mentioned, very similar, approximately 10 to 12%. We've started to push that envelope, push that number in our programs now. We're approaching 18 to 20% in our class sizes for men now in nursing. But that's been, because of the changing paradigm of the way the profession has been viewed. We've had to do a lot of work about moving away from kind of heart and moving more into kind of the science focus and the hard-hitting nature of clinical care to attract more men to the profession.
Thank you so much. Those are both really fascinating histories. And it's interesting how they kind of parallel one another, but in opposite directions over the last 100 years. Although I guess there was never a point where policing was primarily in the domain of women. So, I'm a card-carrying feminist, and my intuitions are always that real equality will require that men do all the things that women do and that women do all the things that men do. So, you don't have to convince me about why it would be important for both of these fields to be much more gender diverse. But I wanted to have each one of you take a moment to tell me why you think it matters. Why does it matter to have more women in policing? And why does it matter to have more men in nursing, besides the feminist reason?
Well, for law enforcement, women are here. Women are here. Women can do the work, and there are women that want to do the work. But more importantly, it's serving the people. And you're serving men and women. And so it's important to ensure that departments are diverse with women and men. Unfortunately, that's not what it looks like. And so it's really important that departments are intentional about focusing on bringing in more women. Studies have been done over and over again, and it reveals that women are better communicators as police officers. They de-escalate issues. When they're on scene, the use of force is decreased when women are on scene. It's just women bring a calming effect to any scene, any case, when they're engaging with the community. It's so you want that when you see what is going on in policing over the last few years, you step back and you're like, you really want more women. You want women there to step in when there's a challenge. But then there are men that are in that position as well. They have capability of being great communicators and being in that place where they can de-escalate. And so what the best part about that is that they're working together. And that's why it's so important to have that diverse force. It's always important to have that balance. And so that's why that 30 by 30 initiative is so incredibly important.
So for thinking about men in nursing, I think in general, my philosophy is that greater diversity in all of its forms strengthens a workforce. For a patient to see themselves in the person providing the care, whether it's what traditionally we think of as hospital-based nursing care, or a school nurse, or a nurse practitioner, or a nurse scientist. As we think about the different ways in which patients experience trust and care, people need to be able to see themselves in the person providing that care. And so nursing has a ways to go, not only in improving the number of men in the profession, but continues to struggle with underrepresentation of, African Americans and Hispanic nurses as well. Although those numbers are continuing to grow, it's sorely lacking compared to our populations that we care, particularly in a city like Baltimore.
Okay, so both of you have sort of suggested that there are issues, in part because of what we might think of as historical discrimination. So the fact that men were last on the list to get into nursing school, and Black men were the very last on the list to be allowed to be admitted to nursing school. And then this issue that Dr. Glover brings up, which is that maybe departments haven't always seen women as a particular asset. So I'm curious to know, what do you think is the relative, like if we think about the pie, and the pie that we're trying to get to is 50-50, what are the biggest chunks? What are the explanations for the biggest chunks of the pie, the explanation of why there aren't more women or men in either of these fields? And so I'm thinking to what degree is it a pipeline problem? So there aren't enough women waiting in the wings who want to do this law enforcement type jobs, et cetera? Or is it an issue of implicit bias or outright discrimination? To what degree do you think that each one of these types of explanations help to explain the persistent malgendering or disproportionate gendering? And I'm going to start with Professor Farley first.
Sure. So I think a couple of things. So from a pipeline perspective, kids are socialized, when they are young. Hey, what do you want to do when you grow up? First and foremost. And boys are driven toward masculine careers and perceived masculine careers, and girls are driven toward perceived feminine careers, whether or not it's intentional or not. There is a societal bias towards certain professions that really come across in various and unique ways. Most of the men who come into nursing do so having never actually conceptualized that as a career path for them when they were young. It was something they were exposed to. Maybe they had an ill family member. Maybe they had someone, themselves had an illness that they needed to interact with the health system, and were exposed to the right nurse at the right time, and helped open their eyes to this as a possible path. So, when we think about pre-health profession schools like high schools, Hopkins has a great relationship with Dunbar High School, for example, here in Baltimore City. It requires, folks to be out on career days, helping people realize what it is exactly. Because if you look at modern portrayal of nursing on the media, it continues to be a very stereotyped gendered role, where a doctor is barking an order and a lady who is playing a role of a nurse runs and does it, has no critical thinking skills. Her entire role is to basically follow the order, and has no real role until she's told to do it, right? That's what our media portrays the nursing profession to be, which could not be farther from the case in reality. So I think we have a long way to go to get gender parity. I think it's a pipeline issue, but I also think when it comes to, looking at the flip side of that, once a male is in nursing, he tends to advance faster and make more money than his female colleagues. So there's that, also the reverse issue. Men tend to go into leadership positions faster. They tend to, advance in their career faster. There is also within nursing that gender imbalance once a male is admitted.
Well, from a law enforcement perspective, women don't see a lot of women in law enforcement. And when they do see, they start to think that it's possible. It's possible. I can do that. This looks interesting to me. And That's how it gets started. That's how it really gets started. There are police departments that have several different types of programs where they're working with young people. And I'm on the board for public safety cadets, and we have a lot of young women, 14 up to 18, and they are just excited about being a part of public safety cadets. And so, which really makes it special is because they're engaging with law enforcement. They see other women in law enforcement. They are participating in, a law enforcement, not real law enforcement activities, but they're able to see what it looks like. And it's incredibly important to have those programs so young people can see that this is something that they can do, particularly women, young girls. They can do this. They could be a part of this. And so more programs like that, more programs in the university, law enforcement centric programming, and even in some of the high schools across the country, more programs like that will bring policing to the forefront for women. Law enforcement is having a big challenge right now in bringing in more women. And it's a leadership issue as well. If the leadership is not intentional about bringing in more women, recruiting, being having that strategic plan and working on recruiting women to their police force, they're not going to be there. They're not going to come. I remember, I was reading an article about a chief that was very reluctant to recruit females in his department because he was concerned about sexual harassment challenges in the department. Now, what's interesting about that was that chief was concerned about bringing in women instead of thinking about, maybe I should be concerned about my officers, the men that are there. Why is he concerned about that? I mean, does he have a challenge without having women in the force? So that's the bigger issue, I think. If your leadership is really not cognizant of really developing programs and developing steps to bring in more officers, that female officers, and just ensuring that department is diverse and it looks like the community that they serve, then it's just not going to happen. It's that leadership. It really is a big leadership issue.
It strikes me that there's sort of an interesting asymmetry in these two fields in a way that, and correct me if I'm wrong, but I feel like what we're describing is the field of nursing sort of suffers from a public perception about who is a nurse. And, I think every time I read to my children, Curious George, which are horrible for a variety of reasons, but also they always mention the pretty young nurse. I completely understand what you're talking about, Professor Farley, but so it's a problem in the public perception of what is a nurse. But then once there are men in nursing, the men have all the social advantages that they've always had that allows them to get to the top of the field, to out earn and et cetera. And so then the question is, well, what happens to the field? What happens to the field of nursing if you have more men? And does it require sort of a fundamental rethink of the very field itself, in the way that it requires basically a fundamental rethink of the field of law enforcement, I think, in order to include women. And so, this is not really a question. It's sort of more of a musing and a statement, but it strikes me that the anecdote you gave, Dr. Glover, about being worried about sexual harassment and not being concerned about what it would mean to clean that up in one's own police force suggests that a total reorientation of the whole nature of the job is required, not just the public perception, but also the whole way that business is done. And so I guess, putting that out there, do you think that there are some good reasons why we should, hesitate perhaps to increase gender diversity in both of these fields?
No, we should not hesitate. Oh, absolutely not. We should not hesitate, because look, let me just say this. I mean, I know a lot of women in law enforcement, state, federal, local, they can handle their business. But it's important that the culture of that department is strengthened. And if that chief has an issue with being concerned, well, that chief needs to really take a hard look at his or her department. That chief really needs to be intentional in shifting his or her thought process and making sure that the culture of the department is so that it is welcoming, that the doors are open and they do want more women. I mean, it's incredibly important. I mean, it's a big deal to the public. It's a big deal to be able to see women and men working together and just seeing someone that looks like them out there protecting them and putting their lives on the line. It's important for them to see that. And particularly, again, I mentioned, young girls. It's so important for them to see other women that are working in law enforcement and just, doing something that, they may have had a fleeting thought when they were growing up and they finally met, someone that they look up to because they want to be a police officer. I remember when I was an agent, I would always get, oh man, I've never met a female agent. And then I'd get focused, I never met a Black female agent, because the numbers that, in the FBI, the numbers are just so incredibly low. There's work being done, to get those numbers up, but they're just incredibly low. And so there's a lot of work that needs to be done, but it goes back to leadership.
I would agree with the no to answer your question up front. We need to continue to work harder. And if we look at, the history of medicine, right, as a gendered profession as well, which has turned itself on its head, well, right? Most admitting medical schools now have a larger female admittance than they do male. And yet pay differential remains structural. So the systemic gender issues are across professions. I don't think it's a nursing specific issue. I think, there's both societal reasons, there's both economic reasons of the gender pay gap. And I think, me not being an economist nor a gender studies expert, they're multifaceted. But if we compare medicine that has now, really done that, 180, and still look at what's happening with the pay gap and look at promotion gap for, some stellar female physicians who are just not advancing as fast as their male colleagues. I think the health system infrastructure needs to be looked at as a whole, and how do we create equity across the board to allow people to advance with the same level of work and the same level of achievement. Interestingly enough, if you ask me what I wanted to be when I grew up as a child, it was an FBI agent. Every single time someone said, "What do you want to do?" as an FBI agent, forensic psychologist, FBI agent, because who didn't love Silence of the Lambs, right? With a female heroine, right? FBI agent. But I think we don't have that positive role model that young boys see and go, "Oh, look, that's a nurse who is a guy I really hate the term male nurse. It's an offensive term. You're just a nurse.
That's right.
But having that little kid see, oh, I can do what he is doing and thrive in that career and be proud of it. Instead, they get, well, why wouldn't you try for medical school first? That's the common retort of anyone who sets their sights on going to nursing. Well, why wouldn't you go and at least try for this? As if nursing wasn't their chosen vocation to begin with, as it was mine. I never planned to go to medical school. Never had that in my sights. After the FBI, I don't know how I made the jump from the FBI to pragmatism and becoming a nurse, but it was. You
wanted to help. You wanted to help people.
I wanted to help people. That's
what that is. Helping, serving.
That's right.
Okay, so we have time for one more question. I do want to mention that Hopkins at Home is going to throw in a link to the chat in just a couple of minutes for anybody who wants to continue talking about these themes in smaller breakout groups. You can feel free to stick around and there'll be a moderated discussion. So I guess my last question is going to be, we've discussed pipeline issues, we've discussed issues of leadership, we've discussed issues of culture, we've discussed issues of advancement to promotion. If I were to ask the two of you, if you could wave a wand and change one thing, and the thing isn't just the number of people, but the thing is sort of like an institutional change that you think would help make your two fields more gender equal, what would it be?
I would say for me, it would be societal norms around that nursing equals caring, which equals a feminine quality, right? To hold someone's hand while they're dying and provide them comfort at the end of the life, as an example, that experience and that grace that's being provided to that individual is seen as a feminine aspect. You're bringing your heart and your soul to that person. And if I could wave, my Harry Potter wand, it would be to change our culture around understanding. We don't think of pastors who do that, right, as a gendered role. We often think, if we say pastor, we often think that that's a male figure. Not always, but that's in our gendered nature. So in that same vein, it's because of the way in which we've been socialized around the nursing profession that in that same role, holding someone's hand as they pass on into their afterlife is considered for kind of a male for the pastor, female for nursing. That's just been beaten into us as we've lived our lives. So I wish I could change that.
Thank you. Dr. Glover?
Yes, if I could change, I would change the thought process, the thinking that women are not as good as men as being in law enforcement, whether they're state, local, federal. Anybody that's thinking that, I'm going to take that wand and just, even like with, Men in Black, just let you just don't even think about that. No, women are there. Women can do it. If there's anyone here that has thought about becoming an FBI agent, and if that's something that you want to do, step out there and try. Because if you're not moving, you're not going to be an agent. So step out there and do it.
Thank you both very much. It seems like we have lots of cultural work to do to break out of the sort of gendered imaginaries and habits of mind. And I laud you both for your efforts, your leadership efforts in these veins. So thank you all very much for this conversation.
Thank you.